Webinar, Unlocking Consumer Digital Health, How Health Systems Can Rethink Patient Engagement to Improve Outcomes and Experience. On behalf of Becker's Healthcare, I am Assistant Editor Giles Bruce, as well as today's sponsor, GetWell. We would like to thank you for joining us. Before we begin, I'm going to walk through a few quick housekeeping instructions. We'll begin today's webinar with a presentation, and we'll be answering Q&A questions we see in the chat throughout the session. We will also have time at the end of the hour to answer any remaining questions. You could submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access that recording. And if at any time you have trouble with the audio, please try refreshing your browser. You can also submit any technical questions into the Q&A box. We are here to help. We are pleased to be joined by an esteemed panel today. We have Brandi Clark, Vice President of Digital Care for OSF OnCall, Kara Roat, Digital Patient Care Manager at OSF OnCall, Michael O'Neill, Founder and CEO of GetWell, and Megan Mancini, Vice President of Strategic Partnerships for GetWell. Thank you all for being here today. I will now turn the floor over to our presenters to begin today's discussion.
Hello, everyone. I'm Michael O'Neill. I'm founder and CEO here at GetWell. Thank you for joining us today. We are so grateful to Becker's for providing this virtual stage to share with our friends and partners at OSF. And we're very excited and proud to share some of the work that we've been doing together at the intersection of consumer digital and patient engagement. Brandi and Kara, who you'll meet in a moment, are true digital health innovators and stars. And we have a star of our own in Megan Mancini, who leads our work with OSF here at GetWell. So I'll kind of be brief. I guess first and foremost, what a journey we've all been through. I've spent 23 years myself in healthcare following a personal cancer journey, and this is different. There are three converging forces demanding kind of innovation and change. And the first one you all know about. One is today's consumer is digital first. They're informed, they're empowered, they're impatient. And they're simply saying to us, this needs to be better and different for me. Secondly, our workforces are in crisis. They're exhausted, they're overwhelmed, they're understaffed, and they're really asking desperately for us to help them streamline their workflow and empower both themselves and the patients they're trying to serve to provide great care. And then finally, our hospitals and health systems are under financial stress. The business of care has always been hard, but today the struggle is multifaceted. Internally, we have lower volumes and higher costs. It's a tough combination, and it's testing the foundational business model we've all operated against for years. And externally, there's a powerful new wave of competition entering and taking on primary care at scale and building loyalty with our patients, via experience and access. So lots of things kind of going on. And if you turn the slide, I would just say, wow, like we've seen this before. In our industry, we know resilience and we know reinvention. What an opportunity to innovate, to transform, to change, and rise to the challenge. Our patients certainly need us more than ever, and they've made it clear about what they want. Here at GetWell, I always talk to our team about, I call it the 3 C's. We are touching about 9 million consumers a year very intimately. And what they're telling us is they want 3 things. They want clarity. It's all just so confusing. The acronyms and medications. I'm being asked to kind of coordinate 5 different physicians on my own behalf. I go to a doctor's office for one thing, I go to a lab for another thing. Just make it simple. Put it in simple terms and just tell me what I need to do next. The second thing they want is convenience. Make it easy for me. I bank, I eat, I connect with friends, I manage my kids' soccer practice schedule, all on a 4-inch screen, and I want to navigate my healthcare the same way. And then third, they want compassion. When it comes to healthcare, this is my life, or it's my mom's life, or my baby's life. I'm stressed out, I'm nervous, I'm anxious. I actually need you to hug me as well. High tech, yes, but also high touch. At GetWell, we talk a lot about delivering digital intimacy at scale. We believe that's the differentiator. We believe that's what your big investments in EHRs and CRM platforms, we believe digital intimacy at scale is the secret sauce to make those foundational investments actually work. So now the powerful part. This patient engagement thing has always been the right thing to do. It's always fit with your missions, but it's always also been a cost center. It's always been challenged by budget constraints and fits and starts and what have you. But today, I think you're going to hear, and I would challenge you to think about consumer digital engagement as a profit center. When it's done right, it will drive your business. It'll drive top line in a fee-for-service world. It'll drive down cost in a value-based world, and it'll drive bottom line in both of those worlds. Consumer engagement can drive your business, and it also will drive outcomes and patient love. So if you change the slide again, here at GetWell, we have this incredible privilege and challenge to work with some of the most incredible healthcare organizations across the United States and globally. OSF is one of those organizations, and we've watched them and been such a part of their journey for a long time and seen them commit long-term to building a foundation for consumer digital that has them on the opportunity side of the challenge of today's kind of forces. And so we're so honored and excited to have them share their story. And I'll let Brandi take it from here and deliver the important information of the day with the team.
Thanks so much, Michael. We are grateful for the opportunity to share some of our lessons learned and a little bit of our journey. So as Michael said, I'm Brandi Clark. I'm the Vice President of Digital Care in OSF OnCall, which is the digital health entity that sits inside of OSF Healthcare System. So OSF has been around for nearly 150 years and has grown to 15 hospitals. 10 of those are acute care hospitals, 5 critical access. We serve a combination of urban and rural markets. So if you switch to the next slide, you can see sort of a map of the regions that we serve. The system has grown, I would say, over the last 5 or so years to nearly double, right? So we are serving over 1 million patients every year, and are just really, really fortunate to be able to utilize our digital capabilities to spread across that entire geography. If you go ahead to the next slide. So as I said, OSF OnCall is the digital health entity that is a standalone entity that does sit inside of our healthcare system. So when our entity was formed a little over 4 years ago, we were given this vision from Sister Diane Marie, who is the president of OSF Healthcare, to always be present where I am, which really resonates with us. It's very simple, right? Only a few words, but speaks volumes about meeting people where they are. I think we know in healthcare, we talk so much about every project, right? One of the guiding principles is it's going to be patient-centered. Our solutions are going to be patient-centered. And then we find ways to center our solutions around ourselves every time. But I think this has really grounded our team that has been developed to support OSF OnCall to really be focused on truly creating a differentiated experience for our patients wherever they are physically, as well as wherever they may be in their own journey of healthcare. So just briefly, our entity is really divided into 3 divisions. The digital experience is that front end that sits as really the digital front door to our health system. So how do patients get to us, and how do they experience us from a digital perspective before they ever would set foot in any of our care settings, whether that is brick and mortar or virtually. Then on the right side is that on-demand in-person brick and mortar access. So we do have some brick and mortar clinics that are run out of this entity. And then right in the middle is the digital care division, which is what I'm responsible for, that spans across the continuum of care in the outpatient and community space, as well as in the acute care space. So what we're going to really focus on today is more focused around that outpatient and community space and how we've utilized GetWell's tools to help us build programs to engage patients in new and different ways than we ever have in the past. So if you go ahead to the next slide, as we think about what were our goals in building digital programs, We certainly need to expand access to care and engage patients on their terms, back to that, meeting them where they are in their journey. Efficiency, we know, is critical. Staffing is always one of those top challenges that we hear about across the industry, and that's not going away anytime soon. So we had to think about how can we in OSF OnCall create value for our system by creating more access for patients in a much more efficient way than we could using any of our traditional means. And then engaging our nurses to deliver timely, personalized care, and that, in parentheses, and feel more fulfilled in their roles. That is almost as valuable as anything. If you think about the level of engagement of your staff, certainly driving the type of experience that they create for your patients. We have some of the most engaged nurses in our entire health system. And that's a true testament to Kara's leadership. She leads that team every day. But I think the way that we built the care model has enabled them to do that. So I'm gonna turn it over to Megan here.
Yeah, perfect. Thanks, Brandi. So for those of you who have been a part of a Becker's webinar before, you may have done this already, but we'd love to just poll the audience really quickly to see if some of these goals that Brandi outlined resonate with all of you as well. Are they a priority? It will kind of help us as we're walking through the presentation. So I'm going to go to this next slide, and it should surface a poll. So if all of you could just take a second to respond with one of these as being a top priority for you, or if there's an other that you want to indicate, go ahead and do that. I'll give it about 10 seconds, and then we'll flip over to see the results. And while you all are doing this, I did see a question come in the chat around, will you be receiving this PowerPoint presentation after? Yes, you absolutely will. Okay, I am going to flip over to the results to see what we have from everybody. Okay, so very, very clear what the winner is. So expanding access to care and engaging patients on their terms. So great, awesome that that resonates. I think you'll feel that a lot through today's conversation, but thank you for everybody that took part. So with that, Brandi and Kara will tell you this in their own words as well around why Loop was the solution to help them in achieving their goals. But for those of you on the phone who might not be as familiar with Loop, I did want to take a second to provide a brief overview just to orient you to the platform at the highest level possible. So Get Well Loop, our overall goal is to help with overall as a digital patient engagement solution. So helping to guide patients through their full episode of care. You'll see this highlighted through the presentation, but Loop can be utilized in a variety of ways and in different areas. So first is when you're thinking about procedural episodes. So how do you thoughtfully engage with patients before and after they have their procedure to ensure they have all information around what they should know, do, and expect throughout that entire experience? We're also utilized within chronic condition management. So thinking about how do you thoughtfully engage with a patient after they've been newly diagnosed with the condition, or following an acute on chronic episode. So when they're discharged from the hospital, how do you help them to understand, why they were admitted, tools that they can use to get back on their feet, and then really help to empower them to manage their condition in the best way possible moving forward. The final scenario is just within the pure discharge setting. So when you're thinking about general inpatient discharge or discharge from the emergency department, how do you engage with your patients in a way that they know exactly what to do within that week of going home? So within all of these different situations, what we're trying to do is take all information around what these patients should know, do, and expect. We're breaking it out into bite-sized pieces, and we push the information out to patients at relevant times during that episode of care. So that information comes in the form of daily automated check-in questions that can be sent on behalf of the provider, the entity overall, really up to you on how you'd want to, how personalized you'd want to make that. But the goal is that we're using very empathetic language while also working with a health system such as OSF to customize all the language to ensure that it has it seamlessly incorporates what you would be telling these patients when you have them in front of you. So on the screen here, you're seeing a sampling of what some of those check-in questions could look like. But our goal is incorporated in each check-in variety of information for these patients where they'll have assessments, tasks, reminders, anything that they would need to be paying attention to over time can be incorporated into that check-in experience. And then on the flip side, for the care teams who are interacting and engaging with these patients, what Loop is really helping to do is provide real-time data into what is happening with every patient that is activated. So built into these check-in questions is alerting functionality. So if I'm a patient, I indicate I don't have transportation to pick up my medications, as you're seeing in the third screenshot here, that could actually alert back to the care team to let them know that you need additional help. All of this happens in real time, so ultimately enabling these care teams to focus in on the right patient at the right time. So with that high level overview, I'll pass it over to Kara just to talk through the goals that Brandi had discussed and really what it was about Get Well that they felt could help them to achieve those goals.
Thanks, Megan. I'm Kara Roat, the manager, one of the managers within our digital care space, and oversee our programs within Get Well. And when we think about why Get Well has helped make OnCall and our digital care program successful, we find the value in really being able to meet the patients where they are. When we think back to that vision statement that Brandi shared that OnCall has of always be present where I am, Get Well gives us the opportunity to really provide care to patients where they want it, when they want it, and how they want it, which is really instrumental in the visioning that we have here within our entity. And then an adaptable solution. So our patient populations are ever changing and their needs are ever changing. So the ability to change, take that base content that Get Well Loop provides, which is wonderful, and then continue to curate that content exactly for that patient population that we're caring for has again been really instrumental in the services that we offer. Better patient experience. One thing that we love about Get Well Loop is when you think about certain conditions or certain circumstances in life and you need education on it. A prime example of this is our pregnancy program. When you have a newly pregnant patient, it's a lot of information when you go to some of those first OB appointments. And so through the loop, we have the opportunity to give that patient the education that they need throughout their pregnancy journey to align where they are within that pregnancy. Saves our care team time. Our nurses will say time and time again that they can be caring for multiple patients through that two-way messaging, two-way chat feature instead of having to call one patient at a time, which really slows down that the ability or the amount of patients that we can care for day in and day out. Epic integrations, we're going to get a little bit more into these here this afternoon, but certainly love the integrations within Epic to provide clarity and consistency with the service that we're offering. And then the availability to have our programs in both English and Spanish is an added plus. So next, we're going to talk a little bit about our timeline with Get Well. We started with Get Well back in 2017 and initiated an ortho, spine, and cardiology programs. Those programs were well underway for a couple of years, and then in 2020, the pandemic hit and really had to shift gears, as many healthcare organizations did with COVID. And so we put on hold our other Get Well Loop programs just to really focus in on what the big need was, and went live with a pandemic healthcare worker program. We monitored patients for about 16 days and really supported them through an unknown time, and had the opportunity to care for a ton of patients within that space for just about 2 years. And then a little later in our journey, we did some Epic integrations in October of 2021, and those include single sign-on clinician views, single sign-on patient access through MyChart, and then some in-basketing features, which are kind of in the slides to come here that we're going to talk about from the Epic perspective. And then the next one that we'll talk about this morning, just a month later after those Epic integrations, is our general discharge program. So any patient who is medium, high, or heart failure risk for readmission, we enroll into our Get Well Loop program and support them for 30 days. We have had that program now about 1.5 years and really have seen great outcomes of patients who are in the loop, getting those check-in questions, getting that education in segmented pieces so it's not too much at once. Having questions that are asking about, do you have your follow-up appointment? Do you have transportation to that follow-up appointment? Do you feel better? Do you have questions about the medications that you were prescribed? To really ensure that we're setting that patient up for success after they're leaving our facilities and achieving better outcomes for those that we serve. Through this experience, really saw the value again of those medium to high risk and heart failure patients and looked into expanding to our lower risk population with a 12-day loop. And have piloted that program for quite a few months, and now over the next 6 months are looking to expand that across all 15 of our hospitals as we have seen success in that area and equipping patients for success. And then lastly, within the discharge space, any patient who gets discharged with home care, OSF home care specifically, gets enrolled in that 30-day loop, and we come alongside those home health nurses to be there when they're not. So home health nursing is super vital for our patients and supporting them also as they leave our hospital facilities, but having us as a backup layer of additional education and additional resource to reach out to has been great to be able to support those patients. And then this past summer, in July of 2022, we kicked off a pregnancy and postpartum support program. Women can enroll in our program from 8 weeks of pregnancy through 6 weeks postpartum. And kind of how I spoke before, it's just really walking alongside those pregnant women through their journey, getting them the education when they need it, asking them questions when they need it, tailored to their journey, has been incredible and has been certainly one of our most popular programs so far. We have very high engagement rates with our pregnant women and did enroll 1,200 women within the first 6 months of the program, which was way more than we had ever anticipated, but something that we've been very excited about. In this space, we actually use 7 care plans from Get Well Loop. We use care plans for each trimester, so first, second, and third trimesters, because again, we really want to ensure that they're getting the education related to where they are in their journey. And then we do vaginal delivery with and without infant care and C-section delivery with and without infant care, and understanding that not all of our moms who leave our facilities take home a baby for various reasons, but we still want to care for that person and ensure that she has the support and care that she needs. And then our most recent implementation was this fall. Here in Illinois, the rates of RSV were very high, much like other places. And so we came to Get Well kind of at the end of October and said, hey, we need to do something about this. They had a pediatric RSV program. And from that time, really end of October, we had a program up and running on December 1st, which really just speaks to the foundation that was laid on both sides, from an operational scalability side on our side from our clinical teams, and just the support that had already been put into place. And then also on the Get Well Loop side, having those care plans in place for us, their implementation team working with us to stand up something so quickly was great. And we care for pediatric patients really from infancy through 5 years. And we do do 2 different buckets of those patients, just given the different ages and the support needed from the age perspective in that place.
Kara, so many questions coming through on this slide. So I'm going to pause and just put a few of them in front of you.
Okay.
So the first is asking if you can talk a little bit more about the implementation process, what teams were involved to make this a success, time that it required, how did you make the rest of your team aware? I know this varies across the different programs we put into place, but would you mind talking about that a little bit more?
Yeah, absolutely. So Megan said it well, it varies program to program. So with the pandemic healthcare worker program, that was a little bit before my time, but probably implemented that within a week, just given the brevity of the situation and what was laid out before, given that we had the previous experience of the orthospine cardiology loops in place. These other ones, I would say it really goes relatively quickly, but a lot of them, maybe we've had an extended journey with Get Well because we've come to them and said, here's what we're looking to do. And they've really walked alongside of us in that journey and helping us make those decisions on how and when and where we should be implementing these programs and what's needed. From our side, certainly the operational team and the leadership team, and then it does take a lot of IT support, just the integration teams, the Epic builders, things of that nature that can make it a seamless process. And Megan, I don't know if you want to share kind of what the standard is. I know we've kind of experienced a little bit of all, but maybe you could speak to what the norm would be.
Yeah, no, absolutely. So our standard implementation takes about, I mean, from start to finish, if you're a new organization where it's determining the areas you want to utilize as well as the type of integration, we can get everything completed within a 90-day period. So during that implementation, we're working within 4 key areas. So the first will be content and workflow. So understanding, you know, what loops you'd want to move forward with, and then what customizations need to be made to those loops. So how are you engaging with patients today? What information should also be incorporated into the loop? The entire experience that you're putting forward for these patients is completely customizable. It's customizable during implementation and then post go live. The next piece is understanding of workflow. So getting a good feel for how teams are engaging with patients today and who's actually conducting that engagement, whether it be over the phone, you're using a different mechanism to keep in touch. We really want to understand what's working well, and we don't want to, you know, ruin that in any way. But where are there also gaps and opportunities to create more efficiency? That's really, really where we want to make recommendations for how and when to use Loop. The final sections are integration, so into the EHR, and then finally reporting and analytics, value planning, metrics that you'd want to have access to would get that put into place. So start to finish, it's about 90 days. Another question that just came through, and this will actually be a really great segue into the next sections, Kara, but asking where do the patient responses or that data, where does that show up on the care team side? So their providers struggle with too many in-basket messages, wondering if daily data and alerts get overwhelming. Are alerts only given if data questions are reported outside of a desired range? A lot to unpack in that one, but it might be helpful if we swap over to the Epic slides and just see, you'll probably be able to answer those there.
Yep, that sounds great.
Okay, perfect. And there are other questions. I promise you, everyone, I will get to those as we go through. This one was just very relevant to the next couple slides.
Yeah, absolutely. So the first Epic integration we're going to talk about is the integration within MyChart. So within our OSF MyChart, patients within their resource tab have a link to Get Well, and they can open up their Get Well Loop content, their portal, I guess, if you will, from Get Well from their MyChart. So this really gives the ability to not have to download another app and create another login. Provide that unified experience for the patient that they have all of their digital healthcare needs, hopefully in one location, and then boost portal engagement rates. So having it all in one place where they know where to go to, they know where they can talk to a nurse or whatever it may be in one place. We have seen an increase in the engagement rates across our patient population, just given the ease of access of having their Get Well within their MyChart.
Perfect. So that's on the patient side. And I didn't mention this when I did my just quick snapshot of what Loop is, but Loop can be accessed today either within the patient's chart through that single sign-on experience Kara just spoke to, but they can also access on the Loop app that can be downloaded onto their phone or tablet or through their web browser on desktop, tablet, or phone. There was another question that came through the chat that I'll just answer proactively here as well. If someone who is older isn't engaging with technology, so a few different options there. We actually have in-house studies that we have completed where one of our most active patient populations is between that 70 to 85 age range. So we definitely have seen success in engaging with older patient populations. The other option is we do have the ability for a caregiver to be a proxy on that patient's behalf. So to enroll themselves, answer questions on that person's behalf. We've seen that work very well with organizations where they have run into something like this. Okay, Kara, I'm going to switch over to the clinician side just to answer the question around alerts, how you're accessing that data, what the care team's doing with that today.
Yep, absolutely. So what's here on the screen is some further Epic integrations within what the clinicians can see in Epic. So every patient who is enrolled into Get Well has within chart review, has an encounter draft. It's a PDF of all of the content within the loop, all of the two-way messaging conversations that are happening between that person who's monitoring from your organizational side. In our case, we have nurses who staff it. So all of the conversations between our nurses and our patients, those check-in questions and what they answered, all falls within this PDF space. That file updates every night at midnight. It doesn't create another encounter within the chart review. It just stays in that one place when the patient was enrolled into the program and continues to update. The other thing, when you click on that chart review, there is a launch right to Get Well Loop, and it will open that clinician view within Get Well Loop, and you can kind of see the more of the live experience or the real-time experience with the patient, kind of the back and forth of that. And then you can send a patient a message right out of there, right from Epic through Get Well Loop to that patient and have conversations back and forth. As far as notifications and overwhelming in that aspect, we have a clinical team of nurses and virtual providers who can see these patients 24/7, 365. And so I think Brandi could maybe share a little bit more about that, like if that's not the model that you have, but still the value of why that's having somebody dedicated to this work is really important to see it be successful. Brandi, sorry to put you on the spot about that one, but didn't know if you had anything else you wanted to share specific to not having a dedicated care team.
Yeah, so we certainly recognize that not every organization is maybe going to have the ability to develop a standalone digital team the way that we have within our system. And I would also acknowledge there are risks and benefits to the way that our organization has built our digital programming. But I think the key that we've learned in all of the programs that we've built and the care that we're providing is if you try to just bolt a digital tool onto the side of an existing care model, that you will get if you take a step back and think about the continuum of the care, think about the journey of the patient, and think about the way that you're going to embed this tool within the model of care for those patients, and all the way down to who are the roles, the individuals on that care team that are going to utilize Get Well Loop as a tool that is embedded in their workflow every day and in the way that they care for patients. If you put it off to the side, I can't see how you get the value. So it doesn't have to be a separate care team, right? Like the downside of a separate care team is we have to do the work to figure out how we integrate with all of the other individuals taking care of the patient in all of our other care settings. So like I said, risks and benefits both ways, but it has to be integrated into the care model.
And along with that, Brandi, I think that goes back to just during that implementation, that understanding of the workflow and what's going well, where are there gaps, how are you communicating back and forth with patients today? What we've seen is organizations, they may have one person, a group of people who are calling patients, and there's specific questions that they're asking. There's opportunity to incorporate a lot of that into the loop. So those questions are proactively being put in front of patients. They're able to answer at a time that's convenient for them, but also enabling a lot of these care team members to work top of license. There's a lot that may come through that might not necessarily be clinical in nature. And so how can Loop proactively get ahead of a lot of that? And I think another piece is once this is implemented, we learn so much once patients are actually tracking through the system. So we'll learn based on the alerts that are generated, the themes and the comments that are coming through. We learn from that and we make adjustments to how the loop has been set up. So we'll be getting feedback from those first responders, we call them. So they're the ones that answer through the loop, triage those alerts. But we are able to make adjustments based on what we're seeing coming through the data from the patients. And that goes to, there was another question just around the training that we're providing to staff. So yes, absolutely, we have a full training that's provided ahead of every go live. So whether it's a team like OSF has, where it's the same group that's answering for a lot of the loops that are in place, that group is completely trained. It's an hour training where they have access to all the levers that they can take advantage of within loop, how they can respond to patient, understand the information that's coming through. That's also ongoing training that can be provided by our team as more people are getting added in. Okay, I want to flip over to this next slide to Kara, just to speak to the in-basket pieces as well. Yeah, go ahead. I'm happy to add on anything as well.
Sounds good. So I think this kind of flows nicely too with, if you don't have a dedicated person, we view this in a different way because we do have a dedicated person, but you can set up Get Well Loop so that whenever a patient leaves a comment or is alerting, whatever it may be, that you would get an in-basket notification saying this patient checked in. You need to go to the loop to see what's going on with that patient and see how you need to support them, which is a great feature if you don't have somebody who's just watching the dashboard for patients and comments day in and day out. A way that we plan to utilize it in this space is, and how we have it set up, is to be able to hand off escalations to care teams. So when you think back to our discharge program and we have that home care loop, we care for that patient, we do what we need to do, but maybe there's some valuable information that the home care nurse would benefit knowing going into that patient's home. And so being able to send an in-basket message right out of that patient's chart to that pool of home health nurses to get them the information that they need to care for that patient is a really great feature to have. So you don't have to kind of toggle between multiple things. You can do what you need to do within the Get Well Loop space.
Perfect. Thanks, Kara. One other question that came through, and then we do have a few people who have prompted to ask about the various outcomes, which is great. That's on our next slide, and we go across all of the areas that are live. But one other question, there's been a few questions that come through just around if someone's not as tech savvy. So how do you get patients that are less tech savvy engaged in the loop process? I have encountered patients that are much less willing to engage in the digital transformation. Kara, Brandi, I don't know if you have any firsthand experience just with how the team has interacted with patients that fall into this category today.
Yeah, I think two things come to mind for me. We have been in this Get Well Loop space now for quite a while that I feel like our clinical team, our nursing team, really troubleshoots very well with patients over the phone to help them guide them through the process. Get Well is super easy to use. It's simple enough for a patient who maybe isn't technologically inclined to be able to use the service or have a family member help them use that service, kind of like Megan had previously said. The other thing that I think is unique to OSF is throughout our healthcare system, we have what we call connect bars located in a lot of the areas that we have hospital facilities. And it's a place where individuals within our digital care team staff, and they educate patients in our community about the technology that we're utilizing, the digital care services that we have. We know that the change to digital healthcare can be hard for some. And so really hoping to walk alongside them in that journey to be able to seek somebody in person who can help them with their account, show them the features within the systems, help them get enrolled into our programs has really been an exciting place for us, and a place that we're continuing to grow as the value is there.
Perfect.
I think I might add just one or two just little tidbits. So glad you hit on the community health worker, our digitally enabled community health worker workforce that really is those boots on the ground individuals in our communities who can help bridge that gap for individuals who may be open but not comfortable with technology. I think the other thing that's important is when we say that we're meeting patients where they are, that means that we know not 100% of patients are going to seek their care in this way, and that's okay. But we know that now from our experience, we hypothesized and now I think have proven that a lot of patients do. And so then that helps us to offset that capacity in some of the other areas in our ministry so that they can take care of the patients who want to receive all of their care in another way, right? It's all of us working together as part of a larger ecosystem. And we recognize that there is not one solution that is going to meet the needs of every person.
Yeah. Thanks for that, Brandi. And I think, Kara, you have some firsthand experience with that as well, where patients have actually indicated the ways in which they want to be communicated with and where they did have more of a comfort level because something was digital. So maybe if you want to touch on some of that, I'm going to flip over to some of the high level outcomes that we have seen across the where these loops are deployed today. So Kara, we'll hand it off to you, but it would be great if you could incorporate some of those learnings from the patient data that we've seen come through.
Absolutely. Yep. All right. So the first outcome we'll look at is a 10% reduction in readmissions from that high risk general discharge patient population. So when we look at those who are engaged within our discharge program, they are 10%. We have seen a 10% reduction in readmissions to our hospital, which has really just led us to the expansion of our discharge program to include those low risk populations. We are in the middle of a redesign of this discharge program, and kind of to Brandi and Megan's point, something that is going to be captured within this space is when that patient is admitted to the hospital today, we already capture what is their communication preference. And so as patients leave our hospital facilities, if their patient preference of communication is text or email, they will come to the Get Well Loop space, get enrolled into Get Well Loop, be supported by our clinical team for 30 days, 12 to 30 days based on their readmission risk score, and help support them in the way that they want to be supported. If their preference is phone, that is great. That's what works for that patient. And again, like Brandi said, we know that digital is not for everybody. So those who their preference is phone, another team will be reaching out to them to support them on their discharge journey. The second outcome that we have seen just in the short time that our RSV program has been live is an 87 for our Net Promoter Score. We get tons of comments within the patient satisfaction area of, I can't believe a program like this is available to me. I felt so much peace knowing that I could reach out to a nurse at any time, 24/7, 365. I had comfort in knowing that somebody cares about what's going on with my child. And so really have seen high patient satisfaction within this space and just caring for those parents or guardians as they care for their child. We served over 8,000 patients through the pandemic. And as you all know, this was really a heightened healthcare experience from patient having so many questions, the unknowns, the education that we had to provide to each and every patient as the pandemic changed and what you needed to watch out for, what the new signs and symptoms were. Within our COVID space over those 14 to 16 days, we asked every patient for their pulse ox reading every day and their thermometer, 2 items that we sent to every patient. And so from our nursing perspective, just trying to give you a view of how high touch, I guess I would say, we interacted with those 8,000 patients. Within our pregnancy and postpartum support program, we have 5 times the increase of depression screening and blood pressure monitoring. So in the depression screening place, we ask questions about anxiety and depression at the 1st, 2nd, and 3rd trimesters, and then twice postpartum. We have seen, a really high need for anxiety and depression resources within this space, and just having that ability to ask those questions at the right times, be there to support them in times of need, has been instrumental and has come to some really positive outcomes for our patients. I'll share with you that quite a few times I hate to say that I can count that women have reached out to us in the evenings, on the weekends, oftentimes when clinics are closed, and have said to us, I feel suicidal. I feel homicidal. My mental health is not okay. And thinking about, they probably wouldn't have called 911 on themselves, but because they've been in our pregnancy program, have established a relationship with our nurses, feel comfortable reaching out and getting the help that they needed, that they might not have done and have led to worse outcomes had we not have been there through this space. And then blood pressure monitoring. Every woman in our pregnancy and postpartum support program gets a blood pressure cuff. We start asking about blood pressures at 26 weeks of pregnancy, then through postpartum, understanding that the maternal hypertension crisis is severe and we have to do something about it. And so I'll share a quick story in this space too. We had a mom who had given birth several weeks later, had reached out to us and said, just via messaging, and said that she had a migraine. These were normal for her. She had them historically in the past. It was nothing new, but the nurse called her anyways just to check in on her and had asked her for a blood pressure. Her blood pressure indeed was very high, and we had to send her to the emergency room, and she ended up on IV blood pressure medications. And so just having the ability to ask those questions, have those resources, again, have those women feel the comfort in messaging us through the loop has led to some good outcomes. And then within our discharge space, our nurses care, it's about 1 nurse to 400 patients is our general ratio within that space, which just shows the ability within a 12-hour shift that's a lot of patients that 1 nurse can care for. I will say we just said the discharge loop in this sense. Every program is a little bit different based upon how frequent those check-in questions are, or the severity of what may be occurring may lead to higher or lower nurse to patient ratios in this space.
Thanks, Kara. A few questions that have come through. So first, there's a lot of interest in the those digital bars that you spoke about. Fascinating idea. What components do you include for patient family support?
Yes. Brandi, do you want to take that one?
I'm going to take that one. Sure.
Yeah.
So as Kara has mentioned, our pandemic health worker program several times. So that program was really born out of a contract that we had with the state of Illinois when the COVID-19 pandemic hit, and we had committed to taking care of individuals through a digital virtual outreach. And so we had hired at that time what were called pandemic health workers, and now have transitioned to digitally enabled community health workers. So these are, as Kara mentioned, specific locations that are set up within our communities. They are outfitted with tablets, as well as dual monitor screens. So our DHWs can sit at that space in the community with a patient or a community member to provide them education about any of our digital tools, even as simple as I just came from my doctor's office and I don't have a MyChart account. They can help them with setting up that MyChart account to get connected to their patient portal, all the way through then all of the tools and programming that we have available through our OSF OnCall team as well. So those are not staffed 24/7, obviously, but there are individuals available at different times throughout the week and on different days with whatever makes sense in that particular location. So those are very tailored to the type of location that they're in. Sometimes it may be an OSF facility. Sometimes it may be a community facility. We have a couple of Connect bars in YMCAs in a couple of our markets, and are exploring a lot of other opportunities to really create that presence of our digital health entity and create that visibility across our communities.
Thanks, Brandi. Another question that came through, Kara, I'll start by answering, but then you can jump on with what your experience has been. So are patients able to self-select the frequency of their communications? For example, please message me no more than twice daily. So what I'll say is those automated check-ins are sent. So first, the timing and frequency of those can absolutely be adjusted. If you want reach out every day, every other day, once a week, that's part of the customization process and would go with your comfort level and how often you want those check-ins to be prompted. And then the check-ins, when they are sent at the very beginning of each day. So they'll receive that notification either via text or via email that will then prompt them to log in through their chart or just through standalone Loop. But they have at their convenience, they are able to choose what time of day they want to check in, usually a time that's very convenient for them. We're never sending a check-in more than once a day. And then when they're talking about commenting back and forth with somebody, yes, they can absolutely indicate if they only want to comment back and forth minimal times or what have you. Care team members can help to set precedents there as well. But we try and make all of this as customizable as possible with the ability for them to check in at a time that's convenient for them. Brand or Kara, anything you would add to that? I don't know if you've received feedback at all.
I don't think I would really add anything other than we set these check-ins on the cadence that we feel is appropriate for that patient population, whatever program they're in. But we also really promote the use of, you can chat with us at any time. We're here for you when you want to interact with us. And so that I think also helps tailor that patient experience of how little or how much they need support from a clinical team.
Perfect, thank you. Another question that came through is, can you share the key differentiators of GetWell versus Epic's own Care Companion, which is fully integrated with reminders, questions, and educations to patients at tailored milestones? And I don't know, Kara, Brandi, if you have any, if you're utilizing that at all today or have any thoughts, I'm happy to speak to that one.
So I'm certainly not an expert in the Care Companion module within Epic. I do know that within our OSF medical group, they have just begun to explore the utilization of Care Companion. And I think the way that our organization has viewed that particular tool is as more of a patient-driven and self-guided tool. That may be an OSF interpretation and an OSF decision. Like I said, I'm not an expert in Care Companion, but they see that as more of a patient self-guided tool, whereas we see the programs that we've designed within utilizing the Get Well Loop platform to be an interactive model of care that drives that interaction and communication between the patient and our digital care team.
Perfect. And I would, from the Loop side, how we've been able to differentiate ourselves is really the depth and breadth of our content. So we have an in-house clinical content team. We have over 250 loops that span 21 different service lines, all that are very customizable. So back to the implementation process, we see that as something that is expected, and it's expected to be ongoing throughout the duration of the partnership. And happy in follow-up. I know there's been questions around sharing this PowerPoint as well as this recording. We can include that Loop library for those that are interested as well. Okay, I know we're coming up on time here, and I did just want to, along with the great outcomes, take a moment to highlight some of the client testimonials or patient love, as we call it. So this is comments that have come directly through the Loop platform. We love these. We share them internally as a company. We're also proactively sharing them out with all of our partners. Groups like Kara and her team have access to the comments that come through here as well. I'll read one of them and then give those on the line just an opportunity to read through all of the ones that you're seeing here. But I've never known a hospital to follow up like this with patients after hospitalization. I'm really impressed with OSF. Whenever I've had a question, someone has responded quickly. I don't feel like I was discharged and then left to figure out everything on my own. So I think, and you'll see the theme just like this come through. It was actually really incredible during COVID, and there was so much patient love that came through on the OSF side. But these people who were, they were quarantining alone, and the fact that they had somebody checking in with them every day, they felt that. It was like someone was with them every single step of the way, and they voiced that through these comments. It's been another really great way to showcase the work that the care team's doing. They're going above and beyond, and sometimes people are called out by name, what these patients had as far as an experience with these people that elevated how they felt better cared for. So it's something so small, but we found it goes a really long way just to really elevate what we're hearing and seeing from our patients. So as we close out, I just wanted to flip over to Brandi and maybe a mix of Brandi and Kara, but would love to just hear what's next for OSF. It's been great to hear about your current state, but with all of this, where are you hoping to go next?
Yeah, so we're certainly still on the journey. And I would say, first and foremost, we have an opportunity to continue to expand the programs that we already have in existence. So Kara talked a lot about the work that we're doing to expand our hospital discharge program. We continue to expand our pregnancy program, and that RSV program will come and go. We know with seasonality, of course. And then looking to other loops that we may be interested in. Our system is building a really state-of-the-art, very large cancer center here in Central Illinois. I think we have a lot of opportunity to think about how do we partner with our oncology service line to utilize Get Well Loop to help us really differentiate the experience and the engagement of our patients who have cancer. So that's, I think, a big sort of near future opportunity for us. And then thinking about that health system integration, I talked about how we're a standalone or within our organization, and that's great because we have dedicated resources, but we really have an opportunity now to really fine tune that integration within our health system so that we ensure that the entirety of a patient's care team, whoever that may be within our system, has the benefit of all of the information that we have gathered from our patients through the engagements that we have with them in our programs. I don't know, Kara, did I miss anything that you would add?
I think that was a great high-level overview of kind of where we're headed.
Perfect. Michael, anything you would jump in here with at the end before I take the last couple of minutes to help answer some of the remaining questions?
Just wanted to close out. We, again, to our OSF partners, we have, as you know, a lot of opportunity to work with a lot of organizations, and there's a common thread when this is done right, and is that we find a way to use technology to deliver trust and hope, to people. And I just want to sincerely thank you guys. It is energizing to work around you. It's inspiring to kind of see the sustained commitment through the ups and downs of industry wins and all kind of things that kind of are going on. But just watching you guys leverage technology to build trust and hope with people who need it is just terrific. So thank you for your partnership. It's been awesome.
Perfect. Thanks, Michael. With the 2 minutes that we have left here, I'll do my best to make it through some of these remaining questions. Anything that wasn't answered, and really thank you for the questions. This is what we were hoping for, to have this engagement back and forth with the audience. But anything that hasn't been answered, we will definitely add that to our follow-up just to make sure we're closing the loop there. But one other question that came through, can you speak to what Loop offers as far as patient education materials, so videos, PDFs, et cetera, for pre-visit and discharge information? So yes, but just as a base standalone care plan, we do partner with HealthWise today to, they help us with the different videos that are surfaced through the loops. We have our in-house clinical content team that is reviewing this content on a regular basis, all come with clinical backgrounds, working with very well-known third-party groups that help with some of the clinical expertise that's included. But we're also working with organizations like OSF to use community resources that they're utilizing. And Kara, I don't know if you have examples of what's been incorporated into some of your care plans that you'd want to speak to.
I think what I would share is that we take some of the standard education and add it to the care plans within Get Well Loop. So the standard education for our healthcare organization and take that information that they're receiving through their PCP office at the hospital to continue to promote that same education, to have that seamless experience, I think would be a highlight for me.
Perfect. And I think we're up on time, but thank you so much, everybody who joined. We look forward to following up with some of you, but really appreciate it.
And thank you. Yeah, that, as you said, that's all the time we have for today. I want to thank our speakers for an excellent discussion and Get Well for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on your webinar console and fill out the post-webinar survey. Thank you for joining us today. We hope you have a wonderful afternoon.
Awesome. Thank you.